Hello everyone, in this video I'm going to explain about ankle arthroscopy. So here I'm going to discuss about all the CPT codes related to the ankle arthroscopy. So try to watch the video till the end. So we will discuss now definitions. Okay. So what is arthroscopy? So arthroscopy is the examination of the joint. Okay. So here the physician will examine the joint with the help of the arthroscope, inserting into the joint, and he will visualize, diagnose and treat the problems. So that is the arthroscopy. Next is the ankle joint. What is ankle joint? It is an articulation between the tibia, fibula and the talus. So that will facilitate the movement of the foot. Okay, that is the ankle joint. Next you need to know about the osteochondral defect. So what is osteochondral defect? It is a whenever there is a damage to the bone and the cartilage, that is called as the osteochondral defect. So it is a damage to the cartilage and the underlying bone of the talus or the tibia. Okay, so OCD you can find in the knee also. Okay, next you have the portal. Know about portal. What is a portal? It is a small incision where the physician provider will make an entry point for the instruments or the arthroscope. Okay, next trocar. What is trocar? It is an instrument with a blunt tip, okay, that will penetrate the tissue and it will provide a channel for the arthroscope. Okay, next we have the loose bodies. What are loose bodies? These are the fragments of the bone. Okay, so this can be a fragments of bone or the cartilage that are not attached and move within the joint, so you can consider those as the loose bodies. Next you need to know about drilling. So here the physician will create a small holes that will stimulate the bleeding and that will promote the growth of the new blood vessels. Okay, for healing. So that is the drilling procedure. Next, what is irrigation? Irrigation is just flushing the joint. Okay, flushing the joint with the help with the fluid. If any debris is there, that will get removed and it will improve the visibility. Steri strips you already aware of. It is an adhesive skin closure strips that will use it to keep the skin incision edges together during the healing. Next we have is the temporary drain. Okay, so what is a temporary drain? A tube which is placed to remove any excess fluid or a blood from the surgical site for short time. Okay, here temporary drains are placed only for the only for the removing any excess fluid or the blood from the surgical site. Okay, this completes the definition. I hope you understood the definitions till here. So coming to the CPT codes. So we have CPT 29891 for the arthroscopy ankle surgical with osteochondral defect excision and or drilling microfracture of the talus and or tibia. So for ankle you will come across the talus and the tibia. Okay, so here the physician, what he is doing, simply he will do osteochondral defect excision, or he will say that microfracture drilling. Okay, ankle arthroscopy surgical drilling he will say, or he will say OCD excision. Okay, in that case you will need to code CPT 29891. So how you will code CPT 29891? Whenever there is an osteochondral defect. What is an osteochondral defect here? It is a damage in the bone and the cartilage. So physician will identify the OCD defect, osteochondral defect. Okay, he will remove loose body or damaged cartilage or the bone. So what are the loose bodies over here? Loose bone, loose or damaged cartilage, these are the fragmented one. Okay, so he will contour the defect to create the stable edges. So drilling technique is performed. How he will do? He will make holes or perform microfracture that will stimulate healing and the blood supply. So I hope you understood now this definition of the osteochondral defect excision. So in arthroscopy, you know, where he will visualize. Then he will do OCD. OCD, he will identify. So what is OCD? osteochondral defect, damage in the bone and the cartilage. He will excise, he will remove the damaged tissue, then he will do the drilling. Okay, so he will create a small holes in the bone that will stimulate new cartilage growth. Okay, so here whenever you are coding any surgical procedure, diagnostic arthroscopy is included. So I have told many times. Then we have drilling or microfracture of the defect is included in the CPT 29891. Okay, so the procedure is performed on the ankle joint involving the talus and or tibia. Okay, so here I have attached the picture of the procedure. It will be easy for you to understand. So first the physician, what he will do, he will identify the osteochondral defect. Okay, with the help of the arthroscope. Okay, so here you can find this is tibia, talus, surgical instruments he will introduce, and he will identify the osteochondral defect. After that, he will excise all the loose fragments, whatever damaged cartilage and loose fragments are there, he will excise them. Okay, so he will perform a microfracture drilling technique where drilling is performed to create a small holes in the subchondral bone. Okay, then he will stable the edges and a base is achieved to promote the healing. Okay, so these are the key points. So it is an invasive procedure. He will remove the damaged cartilage bone marrow and healing, and it will promote the cartilage repair. That's how the cartilage formation occurs. Okay, so next we have CPT 29892 for the arthroscopy, ankle debridement or osteochondritis dissecans lesion repair. Okay, here he is doing the repair. So how he is doing the repair or debridement we will see. Okay, for the OCD lesion. Okay, so he will treat the osteochondritis dissecans lesion of the talus or the tibial plafon. So he will insert arthroscopic portals. He will examine the joint. He will remove unstable cartilage and bone fragments. He will contour the defect and may perform the fixation of the osteochondral fragment or associated fracture as needed. So here what he is doing, he will remove all the unstable cartilage and fragments. Okay, he will perform the fixation. Okay, so he will perform the fixation. So arthroscopic ankle procedure, he will treat the large osteochondral cartilage and bone lesions. He will treat here. He will remove the loose or damaged fragments. He will debride and contour the lesion crater, and it may include the fixation of the osteochondral fragment or the fracture. So he will do fixation. So what are the common indications? Osteochondritis dissecans of the talus, osteochondral defect, talar dome lesion, tibial plafon osteochondral lesion, loose bodies within the ankle joint, chronic ankle pain due to the cartilage damage. So these are the indications over here. So what are the anatomy involved? For the ankle, same thing, talus, tibial plafon, ankle joint cartilage, subchondral bone. So these are related to the ankle region. Okay. So we will see in the form of a flow chart over here. Here patient positioning is done. He will place the patient. Okay. Next portals he will establish. He will diagnose with the help of the arthroscopy and he will assess the lesion. Okay, he will identify the osteochondritis dissecans lesion with intact joint surface and any loose bodies. And he will do fracture management or a tibial plateau. So he will treat the associated talar dome or tibial plateau fracture as indicated. So he will do internal fixation, okay, or bone grafting or lesion fixation and then loose body removal and fracture fixation. So these are the techniques he might do. Okay, so he will apply interfinal fixation so that fracture gets stabilized. He may perform the bone grafting and he may perform the lesion fixation, or he will remove the loose bodies and fracture fixation is done. If any additional fracture fixation for the tibial plateau is also done. Okay, additional procedure any like strips he will apply for the closure and the completion of the procedure, that's all. Okay, this is the repair with the help of the fixation. So this is the arthroscopic treatment. Okay, for osteochondritis dissecans lesion of the ankle, here I have attached one picture. You can see he is introducing the arthroscope. Okay, so here OCD lesion of the talus or tibial plafon. So here you can identify the OCD lesion. Okay, damaged cartilage and the bone. OCD lesion this is. So he will diagnose, and then he will debride the unstable cartilage and loose fragments. Okay, so he is doing now contouring so that he will create a stable cartilage edges, and he is fixing. Okay, he is fixing over here. Fixation is done if needed, and the lesion is stabilized and the joint surface is restored. Okay, so we already discussed the indications. This is a talar dome, this is a tibial plafon. Okay, downside is a talar dome and upside is the tibial plafon. So whenever he is performing the debridement of the OCD lesion, you can code this CPT. Okay, and fixation if needed he will perform. So mostly for debridement you can code this CPT. So we have 29893 for the endoscopic plantar fasciotomy. Okay, so he will release the plantar fascia. Okay, so he will release the contracted or fibrotic plantar fascia which is causing the chronic plantar fasciitis or heel pain. Okay, so with the plantar fasciotomy he is doing with the help of the scope. Okay, so with the help of the scope he is doing plantar fasciotomy. So here he is releasing the contracted or fibrotic plantar fascia. So he will insert the scope through incision and he will visualize the fascia, and he will cut the portion of the right tight plantar fascia so that he will relieve the tension and the pain. Okay, so this is the endoscopic release of the plantar fascia to treat the chronic plantar fasciitis. Okay, so here the patient is positioned and he will local anesthesia or regional anesthesia he will administer, and he will create a small incision and he will passage the endoscope, and he will insert the endoscope and additional portals he will create if needed. Okay, so he will identify the plantar fascia site and he will transverse the division of the contracted or the fibrotic plantar fascia. So he simply releasing the fascia. Okay, so he will remove the instruments and close it with the simple or layered closure. So what are the key components? You must see endoscopic approach is required, and visualization of the plantar fascia, division or release of the contracted fascia, and relief of the plantar tension and heel pain, and closure of the incision. So these are the key components you need to check in the OP report while coding. Okay, 29893 is for the endoscopic plantar fasciotomy. So for open procedure we have other set of CPT code. Okay, so right now we are discussing about scopy procedures. So for scopy you need to give 29893. For open procedure you have other set of code 28008. So this is the endoplantar fasciitis release. Okay, so here the patient is positioned first and the small incision is made in the medial aspect of the heel, and he is creating a blunt dissection. Okay, to create a passage for the endoscope he is making an incision, and then the endoscope is inserted through the incision for to allow visualization of the plantar fascia. Okay, so he is passing the instrument and the plantar fascia he is visualizing endoscopically, and he is dividing that. Okay, he will identify, and next step is the transection of the fascia. He will divide the fascia. Okay, wherever there is a contracted portion, so he will divide that plantar fascia and the fascia is adequately released to reduce the tension. Okay, and the endoscopic instruments he will remove and he will close the incision. Okay, and post-operative dressing he will apply. So we have CPT 29894 for the removal of the loose bodies or the foreign body. Okay, so here CPT 29894 for the will describe what it will describe. It will describe about the removal of loose body or the foreign body from the ankle joint. So here loose body or foreign body removal you should not report with the major procedure. Okay, it is a independent code. So we have whenever the physician using an arthroscope and removing the identifying the loose body and removing the loose body, you can code the CPT 29894. So here we will see flow chart here. Same thing, he will insert the arthroscope into the joint, he will identify the loose bodies and he will remove the loose bodies. That's all. Okay. So here what are the key components? Arthroscope is mandatory and loose body or foreign body identification and removal is mandatory. So he will grab it and remove it. That's all. So here same thing arthroscope. So here like this the loose bodies are performed in the ankle joint area. Okay, these are the fragments of the cartilage or the bone. So he will remove those loose bodies. Okay, so he is removing the with the help of the grasper, shaver or a basket. So he is removing with the help of those. Okay, and the joint he is irrigating and the debris if any he is cleaning that area. Okay, so the joint is he is inspecting and for the loose or foreign material. Okay, and all the instruments he will remove and it close it. So next we have the ankle arthroscopy synovectomy. Okay, we have it in the knee also. Synovectomy earlier we watched. So synovectomy, here the physician will remove the inflamed hypertrophic or diseased synovial tissue or a synovium from the ankle joint. So here the condition is the diseased synovial tissue or a hypertrophic or inflamed synovial tissue. Okay, same thing, he will identify the diseased synovial tissue and he will excise that synovium. So we have 29895 for the removal of diseased synovial lining. That is the synovectomy from the ankle joint. So here same thing, anesthesia administered, portal incision, arthroscope instrument introduced into the joint. He will examine the joint. He will identify the diseased inflamed synovium. He will insert the arthroscope instruments. Okay. He will insert the arthroscopic instruments and then he will perform the synovectomy. That means he will excise the synovial tissue and he will remove the diseased synovium. He will irrigate the joint and final inspection he will do. Okay. So he will remove instruments and arthroscope and he will close the portal incisions and then he will apply dressing. Okay. So here what is mandatory here? Synovectomy is done. Okay. 29895. So what is the condition for the synovectomy to code? Synovitis, rheumatoid arthritis, chronic ankle inflammation, pigmented veilo-nodular synovitis. Okay. So these are the conditions for the synovectomy. So we have CPT 29897 for the ankle arthroscopy debridement. So we have this for the ankle arthroscopy whenever he is doing the limited debridement. Okay, you can code 29897. Here the physician what he will do, he will remove the inflamed or loose tissue from the ankle joint. Okay, so here 29897 is for the limited debridement of the ankle where he will remove what? He will remove abnormal tissues of the synovium or the scar tissue or loose cartilage or impinging soft tissue. If identified, he will remove so that it will improve the joint function. So this is for the debridement of the damaged or inflamed or loose tissue. So here same thing, he will remove the damaged or inflamed tissue. Limited debridement he will perform. He will remove the loose tissue or the scar tissue. So 29897 is for the limited ankle debridement. 2987898 if it is for the extensive ankle debridement. Whenever the procedure is complicated, you can code 29898. Okay. So here it is a step-by-step procedure where he is doing the debridement. So he will insert the arthroscope and he will do diagnosis and he will identify the abnormal tissue. So abnormal tissue can be a synovitis or the scar tissues or the loose cartilage he will identify. So the arthroscopic instruments he will introduce. So he will use shaver or a radio frequency device he will use. Okay, limited debridement he will from the joint, and then he will do irrigation, and then the closure is done. So we have extensive debridement for 29898. So same thing here also, scar tissue, frayed cartilage, hypertrophic synovium, scar tissue, osteophytes, loose cartilage fragments, okay, or other pathological tissue, he will just do debridement. Okay, for that we have 29898. Okay, so here the extensive debridement must be mentioned to code 29898. Okay, he will identify with the help of the pathology, frayed cartilage, synovitis, scar tissue. He will identify with the help of the path report. Okay, and then he will perform the extensive debridement and he will smooth the abnormal tissue. Okay, then irrigation, inspection, and removal of instruments. Everything is done. So, what are the key components? Here, extensive tissue removal should be mentioned in the document, and cartilage debridement, synovial tissue removal, smoothing of the articular defects through irrigation. Okay, 29897 is for the limited cleanup. Whenever a physician is performing extensive cleanup, you can call 29898. Okay, so 29897 for the small area minor cleanup, limited tissue removal. Whenever multiple compartments or significant pathology tissue, extensive tissue removal, you can code 29898. So that is the thing. Same thing here also, but he will perform extensive debridement over here. Okay. So that's the thing. Next we have CPT 29899. This is for the ankle arthrodesis, that is the ankle fusion. So for ankle fusion, you can code 29899. Okay. So arthrodesis means fusion. Arthro means joint. Okay. Joint fusion. Desis means fusion. Okay. So 29899 is for the unlisted arthroscopy procedure. Ankle may be used to report arthroscopic ankle arthrodesis fusion when no specific CPT could accurately describe the procedure. So you can, for arthrodesis, we don't have separate set of CPT code. We have unlisted procedure code. So you can code that unlisted procedure code 29899. Okay. So here the arthroscopic technique to remove the remaining articulate from the joint surface, prepare the subchondral bone, and it will reduce the joint and secure the ankle in a fused position using the pins and the screw. The goal is to eliminate the pain and improve the stability in the patients. Okay, here arthroscopic ankle fusion is performed to permanently join the tibia talus for severely ankle arthritis. Whenever there is a severe ankle arthritis, so here the physician will do ankle fusion to permanently join the tibia and the talus. Okay, so that's the thing. So here same thing, the flow chart. He will remove the soft tissue and expose the joint surface. He will remove the articular cartilage from the tibia and the talus, and he will prepare the subchondral bone for fusion. Okay, he gonna join it. Okay, he will debride the posterior tissue and he will insert the guide pins, okay, in the tibia and fibula region, so that it will reduce the ankle joint into the desired position. And fluoroscopic, with the help of fluoroscopic confirmation he will do, and he will insert a cannulated or cancellous screws for support. Okay, he will secure the fusion, and final X-ray confirmation he might do. So close the incisions and place the drain. Okay, so here he will remove the cartilage from the joint surface, prepare subchondral bone, joint reduction is done, and then screw fixation and fluoroscopic guidance and ankle fusion is achieved. So what is the trick over here is arthroscopy. He will just do fusion with the help of the screws. Ankle arthrodesis, that completes the ankle arthrodesis. So when he is doing the fusion for severe arthritis, osteoarthritis, inflammatory arthritis, end stage ankle degeneration, and the chronic painful ankle instability. So this is the procedure for the ankle arthrodesis. Okay, he will insert the scope, joint examination is done. He will remove the soft tissues. He will remove the articular cartilage over here, and he will prepare the subchondral bone so that it will promote the fusion. He will debride the posterior tissue. He will insert the pins in the tibia and fibula region. He will guide the pins inserted through the tibia and fibula. So this will reduce the ankle joint. He will confirm with the help of the fluoroscopy whether reduction and pin position is correct or not. And then he will insert the cannulated screws. He will secure the fixation, and final X-ray confirmation is done. He will close the incision. He will place the drain and dressing is applied. So this is the end of the ankle arthroscopy CPT codes. I hope you understood till here. If you are interested in surgery medical coding, you can contact me through the link which I will be sharing in the description, or you can mail me through the mail ID which I will be providing in the description. And if you like the video, please subscribe and share. Thank you. Happy